Hi, I'm Lozier, and I'm from University Hospital's Case Medical Center in Cleveland, Ohio. I have gained a deep appreciation through this Leadership Academy as to what it means to me to be a leader and to what I am passionate about. And I hope to use that moving forward as I develop my training program. In 17 years, 21% of our population will be 65 years or older. Yet, in our society, we look at aging as something negative. We learned years ago through Kubler-Ross that we live in a death-denying society. And here we are, 40 years later, and nothing has changed. Yet the alternative to growing old is to die. In our country, we spend a lot of money on things we value, and we value anti-aging. We also value health care to prolong the life, to spare us from death at all cost, regardless of the futility of the intervention. People die less and less quickly. They die more and more over time, living with many years of chronic disease and illness. Palliative care was introduced into our healthcare systems a few years ago to improve the quality of life of those folks who are seriously ill. In our society, we isolate the dying and the old. Even when death is intimate, we decide to try to keep people alive as long as possible because we believe it's the right thing for us to do. So I ask, what's more important, to extend the life of a very seriously older adult or to improve the quality? We don't want to talk about death and dying. Perhaps it's because we're not ready to, yet our older adults are. Erik Erikson taught us years ago that the last stage of our psychological development is integrity versus despair. Many of our seniors are wanting to talk about this. Maybe we don't want to talk about it because we don't want to be left behind. We don't want to think of the pain that will come from the loss of that loved one. But death is not a failure. It is part of the life cycle. And we teach that to our children even when they are very, very young. We need to start talking. My Action Learning Project is developing a training program for social workers who are experts in communication to work with our older adults and their families to have discussions about end-of-life care around the kitchen table and not in our ICUs. Thank you.